I'm going to illustrate the approach to the assessment of enthesitis. In the Spondyloarthritis Research Consortium of Canada method, we assess 16 locations for enthesitis. And these locations are distributed in the upper limbs and the lower limbs. And I'm going to test these various sites and ask the patient if they have tenderness, yes or no, in these various locations. I'm going to begin with the upper limb, and in particular, I'm going to look at the entheses around the elbow. I'm going to support his right arm with my hand like this and use my left thumb located over the lateral epicondyle and then just below the bony prominence of the epicondyle. I will exert sufficient pressure to blanch the nail of the bed. Is that tender?
Yes.
And now I'm going to turn the arm around and I'm going to, again supporting the arm, locate the bony prominence of the medial epicondyle, and just adjacent to that I'm going to exert pressure sufficient to blanch the nail bed. Tender?
Yes.
Okay. Now we're going to move to the entheses in the lower limb. I'm going to ask Whit to move over onto the left-hand side. And what I'd like you to do, Whit, is just to rest your right knee on the examination couch. Now this maneuver makes it easier to locate the greater trochanter, which is the first entheses assessed in the lower limb. So this is the bony prominence of the greater trochanter that I can feel with my right thumb. And I'm going to exert pressure on the posterior-superior aspect of the greater trochanter. Again, sufficient to blanch the nail bed. Is that tender?
Yes.
Okay. If you could just roll back onto the bed and just make yourself comfortable again. The next enthesis is the insertion of the quadriceps tendon into the superior pole of the patella. So this is easy to locate. I'm just going to hold the patella and I'm going to exert pressure at this location with my left thumb. Sufficient pressure to blanch the nail bed. Is that sore?
Yes.
Okay. Now I'm going to hold the patella with my left hand and locate the inferior pole of the patella. And this insertion into these two locations counts as one tender enthesis. If either one of these or both are tender, this counts as a positive enthesitis evaluation at this location. So I'm going to first of all press on the tibial tubercle with my right thumb. Is that tender?
No.
The patient reported no. I'm now going to exert pressure with my left thumb on the inferior pole of the patella at the ligament insertion. Is this tender?
Yes.
Okay. And now we're going to look at the Achilles tendon insertion into the posterior aspect of the calcaneum. So ask the patient to slightly dorsiflex the ankle joint and follow the Achilles tendon into its insertion into the calcaneum. So this is the proximal insertion into the calcaneum. And I'm now going to apply sufficient pressure to blanch my nail bed. Is that tender?
No.
For the assessment of the plantar fascia, I'm going to use the index finger and form a knuckle. And I'm going to exert pressure on the anterior aspect of the calcaneum and slightly medially. And if you could tell me if you feel tenderness or not, Whit?
Yes.
Okay. So we are going to now complete the assessment of enthesitis by assessing the supraspinatus enthesis attachment into the greater tuberosity of the humerus. So if you could sit up, Whit, and just make yourself comfortable on the edge of the couch. I'm going to illustrate how this needs to be done. So first of all, we're going to locate the clavicle and follow the clavicle to the acromion. And my thumb is right over the acromion. And I'm going to just extend the elbow backwards a little bit. And just below, anterior and inferior to the acromion, is now the greater tuberosity of the humerus. And this is the site of attachment of the supraspinatus tendon. So I'm going to exert pressure now, sufficient to blanch the nail bed. Is that tender?
Yes.
Okay. So that completes the assessment of the SPARCC Enthesitis Index. If you'd like to lie back, Whit. So we've now assessed 16 enthesitis sites, and that completes the assessment of this index.